Welcome to the Hispanic Collaborative Community Working Group. We're so glad that you gave us some time today, certainly during this global pandemic, and we certainly want to thank you that you thought this worthy to take up another Zoom meeting on your calendar today. I know that everyone is facing Zoom fatigue these days, so thank you so much. We are very honored to have some key guests with us today, and we're also very excited about the work that we're going to do in committee and get focused on how do we assist our community to be in the best possible position for full economic recovery. Before I get started, I did want to thank many of you for all of the work that you have been doing in our community, for all of the assistance that you have been providing, and all of the care and effort that we've given to neighbors and friends and family and community during this time frame. It definitely, the saying of "it takes a village" couldn't be truer today, and certainly our community is reaping the benefits of all of your work. So thank you so much for that. I did want to call out specifically 4 organizations who right now are partnering on distributing over $100,000 in funding that we are distributing in community to families without access to other resources. And those are Mexican Fiesta, 16th Street Community Health Center, Voces de la Frontera, and Catholic Charities. For your leadership and work in that area. Also for those organizations that have been stepping up to the call, such as the Latino Chamber of Commerce of Southeast Wisconsin in creating the hotline, as well as the low interest loan fund that you recently came out with, SOC at 3 o'clock with your community dialogue, as well as 16th Street with the Facebook Live with Dr. Romayo. So those are just a few of the highlights of what's been happening in the community. Thank you for those of you who are meeting with us on our weekly calls. All of this is very important. And as you'll see today, we have been listening intently and stringing together the key pieces that are needed to put our community in the best possible position. Without further ado, I do want to kick off our program, and the person who I'll bring to the spotlight next is our board chair, Rolando Rodriguez, and CEO of Marcus Theaters, and somebody who, you know, if we think about at one point during this time frame, and I don't think the numbers are too much better, as he shared with me, every single movie theater in the world was closed at a time frame within this COVID pandemic. And so to think about that and how to operate in an industry under those constraints, how to keep the lights on and how to keep people employed, he's definitely one of my heroes, and I'm so glad that he is on our board and shares with us the wisdom that he does. So Rolando, thank you for joining us, and you are on.
Okay, well, thank you so much, Nancy. Really appreciate those kind words. And let me start out by echoing certainly Nancy's comments of thanking all of you in particular on this Zoom meeting for your leadership. Our community needs you, our community appreciates you, and the work that you're doing is very, very meaningful for all of our folks. Let me also just take a moment and really Nancy, take a moment and really on behalf of all of us appreciate the incredible work that you and Andrea are doing on leading you know, all of the efforts on behalf of the Hispanic Collaborative, which is very, very good to see. And hello to everybody once again. As Nancy pointed out, I'm Rolando Rodriguez. I'm the CEO of Marcus Theaters, and very, very proud to be the board chair for the Hispanic Collaborative. You know, it's been about 10 weeks since the United States declared a national emergency regarding the COVID-19. And in that time, our way of life has changed in ways that we have never seen before. Thinking back to where we were in February at our last quarterly meeting, I'm reminded of a quote, and this is an interesting one from Mike Tyson. Once said, "Everyone has a plan until they get punched in the face." Leadership during these times of crisis is important to not just our way of life, but to securing life itself. This is why I'm pleased and honored to introduce to you today Governor Tony Evers, a man who through his leadership has shown deep commitment to preserving the health and welfare of every resident in Wisconsin. A leader who has marshaled resources to ensure support to vulnerable communities and small and diverse businesses. The state's recent $2 million commitment to direct grants to ethnic minority businesses and enterprises through the Wisconsin Economic Development Corporation provides a lifeline to many of our Hispanic entrepreneurs that will serve to help many of them survive through these times. We appreciate Governor Evers' administration, ongoing support, and their commitment to the Hispanic community. Equally as important, we appreciate Governor Evers' leadership. Please welcome the Governor of the state of Wisconsin, Governor Tony Evers.
Thank you so much, Rolando, and your kind words. I really appreciate that. And good afternoon, and everybody out there, and thanks for having me be here today. I want to start by thanking all of you for what you are doing to help keep your families and communities and neighbors safe by staying home when you can and doing the social distancing thing. The COVID-19 pandemic has changed so much about how we operate, from how our kids learn to how we spend time with our family and how we grocery shop. And I don't have to tell you at all that it has hit the Hispanic community particularly hard, both in health and economic well-being. Much of the Hispanic workforce in the Midwest are in industries that happen to be some of the hardest hit by COVID-19 and the other essential businesses. So I want to recognize and thank the Hispanic community for helping keeping Wisconsin running. But I also want to assure you that the state is committed to doing what we can to support you, not only during these challenging times, but always as we strive to close the gap on the economic, educational, and health disparities that are holding Hispanic communities and our state back. I know that this is a key mission of the Hispanic Collaborative to improve outcomes and increase household incomes. And we want to support that mission in any way we can so folks have the resources and the opportunities and the tools they need to thrive in their economic, educational, and health goals. So as we continue to tackle the COVID-19 pandemic, we have to continue to work together to ensure that we have a full economic recovery, to ensure that everyone who needs a test gets tested and gets appropriate care, and to ensure that we bounce back together. And I can't overestimate enough, I don't want to underestimate the need to get tested. That is really important, not only for individuals, but it's important for us as a state to do the best job we can in keeping this pandemic from going even making things more difficult for us. So now more than ever, it's time for us to be good neighbors, roll up our sleeves, take good care of ourselves and each other. Because regardless of where we live and our background and our identity, we're all Wisconsinites, and there's one thing that will always connect us, and that is our core Wisconsin values of kindness, respect, empathy, and compassion. It's important that we keep hope and push forward, because at the end of the day, we are all in this together, and we will all get through this together by staying safe, staying healthy, and staying home. So thank you. I'd be glad to answer the questions you have prepared for me.
Thank you, Governor. So we do have a couple questions from folks. I can read those for you.
Okay.
Here's our first question. We know that education is near and dear to your heart, and that you, as we do, also believe it is a catalyst for upward mobility for communities of color. With the potential continuance of safety measures until a vaccine is in place, what do you believe school districts, students, and families need to do to ensure the effects of the loss of learning doesn't hinder a population for a lifetime?
Well, you know, that is a great question. I'll tell you that, Nancy. And I can't answer that just in one way. I'm going to kind of morph around here a little bit, if you don't mind. But first of all, what I believe how I'd answer that is, in order for us to continue to have opportunities for our kids to learn, we really, because this has been such a, frankly, dangerous situation. We've had a fair number of deaths. Obviously, every one of them is a loss to our loss to our society. A lot of people have been sick. Our kids, especially our little kids, need to feel safe. And but that doesn't mean, you know, I'm thinking of it as a grandparent. My kids are all grown up, but I think of it as a grandparent. I want my kids to understand how important being safe is, and how easy it is to be safe. It is, you know, pretty simple. You want to make sure that you don't, that you wear a mask if you're out in public. I think that's an important thing. I think it's important to keep a safe distance from others and wash your hands. All the things that as adults we know, and especially now we know and understand, that keeps us safe. Our Safer at Home effort has saved lives and kept many thousands of people safe that would not have been. So if we want our kids to feel safe, they need to understand what it means, what they have to do to maintain that safety. And I think that's really important. The other thing is just the making sure that, and I've been asked this, I think, at least 5 times just today by media outlets, but what I'm hoping for next fall, and especially because of my role as state superintendent in the past. And we're under discussions with Carolyn Stanford Taylor, who replaced me as state superintendent in the Department of Public Instruction, and the folks that work in schools all across the state, as well as school boards. And I want us to start, and we were discussing things, but I always start out by saying, whatever we can do, our goal should be to have school next fall. But then I also argue that we can't be stupid about that either. We have to have, that should be our ultimate goal, but it may not look like it has in the past. And we should just be ready. We need to have a plan A, a plan B, a plan D, and all those things are important to be in place. You know, for example, if we decide we can open up regular school year next fall, or maybe even earlier, we will likely need to test every adult that's part of a kid's life in school. I think it's doable, for one thing. We have testing materials. We have people that know how to test, but it's not just the teachers and the paraprofessionals, it's the custodians and others that work in school. It's the people that deliver milk and food to the school. We need to know, our kids and our families need to know that the people that are interacting with them are safe. I think that's a reasonable expectation. I think that's a number one priority. But we also need to understand that if we're in the middle of a surge, that we may need to maybe go alternate days to school, or end the first semester earlier than before. We just have to have flexibility. That's my bottom line. I think I feel confident that with the efforts that we have had around contact tracing and testing, and making sure that We have the equipment for those frontline workers. We're making progress on the public health front. Things are a little more complex in this state because of the Supreme Court ruling, but regardless of that, we have to be prepared. And so I'm looking forward to having school next fall. I think it will look different than it does now. I don't think it will have to be all online or virtually. I think that I'm a little old-fashioned around that. I'm not sure that works for every kid and every parent. But the more we can have interaction face-to-face between the student and the teacher, the better it will be. So how about that for a long answer to a short question?
Thank you so much. We do have one other question for you. And I think it's a very interesting question. So what has been the hardest statistic or reality to deal with during this time frame? And conversely, what has been your most positive or uplifting experience during this time frame?
Yeah, the hardest statistic clearly is people passing away. I know we can sit back and say, well, it's lower than Minnesota or Michigan or Illinois, and it is, but one is too many. And clearly, every day that we add another person to that list, it hurts. And one is too many. But it also spurs us on to do better things and continue our work to make sure that we get people tested and make sure that those people that are tested positive get the support they need. But clearly, when someone loses their life, that's clearly an easy answer. It's that statistic itself. Now, a lot of positive and uplifting experiences actually during this time frame. Seeing people recover after being near death, I think that's exceedingly uplifting and positive. I think, and I'm as I encouraged before, but I'm encouraged by the number of people that are willing to be tested. But we have, whatever we can do, and you as an organization, that not only helps us identify who's ill, but it helps us identify how the virus works, and it allows us to do the contact tracing and all those things that are public health. It's important to do. So the more people we test, the more we're going to cut this short until a vaccine. That is really important, but we've had great support from people for that. And another really positive, uplifting thing, I know it was the focus of the Supreme Court ruling, but nonetheless, we had outstanding responses from around the state about safer at home. People did stay home. Obviously, not everybody did, but the vast majority of Wisconsinites kind of set their lives aside for a period of time. And by doing that, we absolutely reduce the number of deaths we have in the state and reduce the number of people that were identified as COVID-19 positive. So that, as a state, that was very, very uplifting. And another small thing, and then I'll be quiet, but contact tracing, I've mentioned several times. It's so important once we identify who is ill, who has the virus. We need to kind of check the people who they've been with and make sure that they're okay, and make sure that they self-quarantine themselves for 14 days, and all that's hard work. And it's frankly always been there. Your local public health people have been doing this forever, and it's just that we have had to amp that up. But we set as a goal to hire 1,000 people and as limited term employees to do this work, as putting them around the state and helping out local people doing this. And we were looking for 1,000. And to be honest with you, when we did that, I thought, if we get 500 people to suggest that they want to be considered for this position. I think we're going to be lucky. But we had 4,000 people, and we could have gotten lots more, and we're continuing to do that. And we made an extra call for those people that are bilingual, so that they can help us making sure that everybody feels comfortable about having this conversation, and especially if their first language is in English. And that we had great support around that and a great turnout. So that just goes to show you that, you know, it's not the money that are bringing these people to take these limited term employee jobs. It's their belief that they can make a difference in the lives of people. They can save lives. They can provide a service to the state of Wisconsin. That was, frankly, shame on me. I underestimated that goodwill, because it was clearly there in the state, and it was just a good reminder to me and how important people believe that this is doable. We can beat this, and it's going to take a lot of work together to do that. So, another long answer to a short question. Sorry about that.
Well, thank you so much, Governor. Those are really fantastic responses, and Hispanic Collaborative knows firsthand that response that you're talking about those contact tracer positions. We helped put the word out, and I also was surprised at the quick and number of responses that we got, and hopefully we'll see those folks in action helping community. So thank you for helping Hispanic community. Thank you for your time today, and thank you so much for your leadership.
Thanks so much. Enjoy the rest of your meeting. Thank you.
So we did have a couple more questions, and what we'll do is we'll forward those along, and we will we will send any questions to you and have the governor's responses, if they can, forwarded and posted on our chat or as part of the notes to this meeting. And we are recording it, so we will put that recording out as well. So our next session here, what we're going to do is we're going to do a deep dive into the effects that COVID-19 has had on our community, and share some statistics and share some scenarios with you that hopefully will add to your conversations that we'll have in breakout sessions right after this. So with your permission, I am going to share my screen. And I think now that you should be looking at our PowerPoint, and that is what I will go through today. So when we started looking and when we started bringing folks together, as the Hispanic Collaborative does, a variety of discussions, and looking at how can we best assist community during this time frame. We came across a couple key themes or a couple key areas, and that's really kind of how we triage both some of our dialogue and some of the data. And so we're going to present that to you today in that manner. We'll talk a little bit about how COVID-19 has affected the health of our community, financial stability, do a quick dive into business, and then education. And this will give us a picture of what COVID-19 has meant for our community. So the first piece that we will delve into here is health. And what you're looking at here is we have been keeping an eye on the county dashboard since the 1st of April. We have been looking at this on a daily basis, both the visuals, understanding geographically where what parts of the city this is affecting, as well as the overall count. And this blue line that you are looking at here is really those cases mapped out and what trajectory that is taken. And you can see that it has gone from roughly 30 or so cases in the beginning of April to this morning's count of 1,361 cases, confirmed Latino cases in just the county of Milwaukee. So to give you an idea of what that looks like, you might be able to see here how this slope looks. But if we think of the time frame in the beginning of early April till now, the rate of increase in that line is a lot faster than what we see in the entire month of April. And trying to think of this in terms of, these numbers, unfortunately, and the rate of change don't just paint a picture for what's happening today in our community. Understanding how COVID-19 manifests itself, the time frame it needs to begin to show symptoms. We are potentially looking at a 2-week window of cases that are out there that will continue to feed into the increase of this line. We also wanted to give you some more context on what does 1,361 cases mean, right? And how can we put that in context of our population and our community. So we represent 27% of all county cases. That is the second highest rate in the county. African Americans represent a bigger number of those cases. And in the state, however, we represent 31% of all state cases. So this is a big number, and not all of these are attributed. This 1361 is only about a third of the overall state cases. We have other hotspots within the Hispanic community happening throughout the state, most of those corresponding to large urban areas, or the larger urban areas. Whether we look at this via the county or via the state, the percent of the Hispanic population that has tested positive, that has COVID-19, is just around 1%. At the state, it's actually 1.02%, and at the county, it is 0.97%, so right around 1%. So that means that out of every 100 individuals that we know, one of them has tested positive for COVID-19. This is the highest rate, both for the county and the state. Hispanics have the highest rate of infection of any other ethnicity. So that is certainly something for us to be concerned about. As I shared before, with the increases in testing occurring in community, there is a very high positivity rate, sometimes in upwards of 30 or 40%. And so I would urge us to continue to look at these ethnic slices of the data. I was looking at news, as I'm sure many of you were yesterday, and they were talking about the overall positive test rate dropping over the past few weeks and being at about 4%. That is true for the overall state, but that is not true for our community and certainly our hotspots occurring throughout. What we have, in addition to the data, what we have also heard are a couple key things from you as we have talked about this health and what this means and what is happening in community. So there are a couple key factors that are contributing to this. Certainly, we have a high number of individuals in that essential worker category. We also have a high density of people in neighborhoods and in households. Certainly, the lag and sometimes lack of Spanish language communication has contributed to a delay or perhaps a confusion in how to best protect yourself. And then the hotspots that we are talking about correspond with high Spanish dominant immigrant populations. So close to 80 or 90% of our overall cases in the county all correspond to 53204 and 215. Other things that we are hearing as the state starts loosening up and going back to work, we also are hearing from you, what will the results of opening up the economy be as we send out more Latinos and more essential workers back to work? And how do we make the workforce safe and share with them what they can expect from a safety measure in their workplace? So those are some key things that we have been hearing from many of you in community in regards to health. The next area that I'll delve into is financial stability. So we pulled just a couple key data points for you from here. So you heard me say certainly that the number of concentration in essential worker category is important. This graph to the right certainly points that out. So these little people here in these 4 industries on top, food prep and serving, building and grounds, farming, fishing, forestry, and production, represent 80% of our workforce just in those 4 areas. And those 4 areas are certainly some of the hardest hit by COVID-19, to give you an idea of what that means from a financial stability standpoint and where our community is in terms of center mass for COVID-19. The other thing that I'll point out is if we start looking at the finances of our households going into this, to COVID-19, because that certainly gives us an indication of how they might weather a financial storm. The graph to the left is for the entire county, the Latino population in the county. The average household income in the county of Milwaukee is almost, it is $49,636. That is the average household income across the county, regardless of ethnicity. So here you can see that 51%, over half of our population in the county, is under a $40,000 household income. If we add that 40 to 50,000 range and assume that a lot of them will be under there, we're close to 60% being under the median household income for the county. So this shows, this corresponds certainly with the amount of wealth in a household. This corresponds with the amount of savings in the household. And this gives us an indication of how our families and households might be able to weather the storm. The other piece that we did is we looked at what does an average household make if we took an average of $40,000 a year in household income coming into the house. And what were the major categories and the average costs of those in terms of rent or mortgage, in terms of food and transportation, and just those 3 costs. And what we did find is in households with no income coming in, which represents 30% of all Latino households, by the way, they're racking up debt at about $2,000 a month. For those households, if we can assume reduced income equals half, it's half that amount, $1,000 a month. But we also know that it takes 8 to 12 months because there's very little margin in those households to play catch up. And that's a really long time to expect any creditor to hang out for their dollars. So additional things that we heard from community, again, high concentration of workforce in just 4 industries. A concern about what does this mean from a standpoint of evictions and foreclosures. Is that a wave that we can expect next to hit our Hispanic communities? Also, in relationship to financial stability, a reminder that we have potentially up to 20% of our families that do not have access to other financial resources, such as unemployment or expanded unemployment, or any single payment financial stimulus payments, single financial stimulus payments that came through. So when we say no income, we really mean no income for a large percentage of our families, relatively speaking. The other is, as I mentioned, 30% of our households have experienced loss of income. Another 40% have experienced reduced income. So that brings the number of Hispanic households that have been affected to 70%. Add to that we haven't fully recovered from the 2008 recession, and what we're also hearing in terms of the role that college students are playing now in terms of finances in a household and putting their own education at risk, as well as the difficulties maneuvering right now because of digital abilities. So moving on to a business perspective, there are two charts on here. So the one on the left is a layout of where our Hispanic-owned businesses are. How does our Milwaukee Hispanic-owned businesses lay out by industry? And if you looked at some of these and understood from the lens of COVID-19, we're estimating about 75% of our Hispanic-owned businesses are also in that highly affected area. We also know that 65% of all Hispanic-owned businesses are immigrant-owned. Immigrants still represent the largest growth rate for new Latino-owned businesses, and they represent the largest portion of Hispanic-owned businesses, period. We know that many of them might be ITIN businesses, and that they also, those ITIN businesses are in positions where they also don't have access to federal resources. If we look at some statistics from just a crisis standpoint, 25% of all businesses fail in a crisis. This crisis probably represents, as many of you have heard, unprecedented levels of economic impact, both in business and in household. So that 25% might be low. We don't know yet because we haven't gone through this before. On the right, we're looking at, this feeds into kind of a triage model. If we look at 25% of our businesses need to fail, we also know that we have a percentage of them that are solid and will succeed. And it's really those players in the middle that we are concerned about that we might be able to have some effect on. Not that we're not concerned on all of them, we certainly are, but we also have limited resources and we need to focus attention on areas that we can most likely affect. So what we have heard from the business standpoint, one of the key things that we've heard is our small businesses anchor our community, thinking about their relationship to economic corridors, thinking about their relationship to building wealth in the community and being a catalyst for educational attainment. The other key piece that we heard is that the business's ability to pivot is directly related to their digital literacy and digital ability in this time frame. And that has proven to be a big vulnerability for us. So the last area that I will go through is education. So just to give you an idea of what we mean, 37% of our population is under the age of 18. So we have a really big chunk of students, both in the K-12 pipeline and a growing percent of students in the higher ed pipeline. To that tune, 60,000 students between K-12 and higher ed. That's and that is just for our county. So those are two really big numbers, and as the governor was talking, we need to be concerned about education and what impact this loss of learning during the semester means for them. So if we assume that no students going into the fall or at the end of this semester are academically whole, what does that mean for our community? And what do we need to do to be better prepared as a community, as we also heard the governor say that there are high prospects of some types of continued adjustment to school as we know it in the fall. The other area that we will add here that certainly touches, has touched all of these slides that we've looked at is, again, internet and digital abilities. And Hispanics nationally have the highest percentage of smartphone dependency households, meaning their only access to internet is via their phone. What we also heard from you, on top of connectivity is a big issue. I think the other thing here that we haven't heard yet is concern regarding MPS. We have a big portion of students in MPS, 15,000, or give or take a couple thousand. And right now, they do not have active online teaching moments with their teachers. So what does that mean for material that hasn't been addressed? You know, they've only been looking at review, and how do we help shore up those students from a being prepared and making them whole standpoint? So it is 3:45, which is very good timing. And what's next for us, what we want to talk about, or what we're going to shift over in committee work, is looking at these 4 areas of information. We triage that information and put some things relevant for each of our strategic committees: civic participation, entrepreneurship and innovation, and prosperity and vitality. So while we feel our long-term goal of reaching top 10 is still very relevant, these are still goals that we are striving to get to, and certainly are related to today and tomorrow. But we do also know that our interim work requires changes in response to COVID-19, whether it's a changing of priorities, that some issues have become more important for us to tackle first, or whether there are new pieces that have just become clearer during this pandemic. So our discussion that ensues in our strategic committees, you have a leader in each of our committees along with our co-chairs in those areas. We're going to be looking at some data with some key questions, and our discussion will revolve around, you know, we want you to be thinking, what do we need to do to ensure economic recovery? Are there any opportunities that are presenting themselves to leapfrog? And what are each of our roles, whether as individuals or organizations, in that process? Those are 3 things we want you to keep in mind. So links have been sent to your email. They got sent probably about at 3:30, so just a few minutes ago, for your breakout sessions. So we do want you to log out of this webinar. That email came from our team, Andrea Barucci, I believe. Find that link and link in. You should be grouped into your breakout session right away. This will be the only time that you need to depart our session and go back in. And we will regroup as a full group after those breakout sessions at 4:45. Are there any questions for me before we go to our breakouts? All right, perfect. So we'll see you back here. Well, we'll see you in your groups in just a few minutes, and then we will see you all as a group at 4:45.